Acute pyelonephritis is acute renal parenchymal inflammation due to bacterial infection. It is most commonly caused by retrograde or ascending type of infection which goes through the urethra into the urinary bladder, then to the uterus, to the pelvis, and then to the renal parenchyma. It is most commonly caused by E. coli infection. Hematogenous infection in case of severe septicemia is also possible, but it is much less common. In that case, the most common organism causing acute pyelonephritis is usually Staphylococcus aureus. So here we have part of the renal parenchyma. This is the surface of the kidney. Here we have the cortex with multiple round glomeruli. Those are these structures. And in between we see multiple renal tubules. In the periphery we can see perirenal adipose tissue, which is also infiltrated by acute inflammation. For acute pyelonephritis is typical microscopic neutrophilic infiltrate, which is typically localized in the tubules, and glomeruli are relatively spared, unlike in some cases of glomerulonephritis. Sometimes we can see abscess formation, like here, for example, and if we go closer, we could see that all of these inflammatory cells are neutrophils with irregular lobated nuclei. Well, actually, in this area we also have a lot of lymphocytes and plasma cells, so let's go somewhere else. So, for example, here we have slightly more neutrophils. Some of these cells are already karyorectic, and some of them are necrotic. Acute pyelonephritis, as we already mentioned, is most commonly ascending type of infection, and therefore it is associated with lower tract problems as obstruction, reflux disease. It can be also associated with pregnancy and diabetes. Sometimes it can be complicated by papillary necrosis, especially in patients with diabetes mellitus. Thanks for watching.